Well, good morning, everyone. And for those of you who have yet to meet me, my name is Dr. Art Veyer. I'm president of the Medical Society of Virginia. And welcome to this morning's webinar about the COVID-19 vaccine and its access for the healthcare provider community. We are pleased to partner with the Virginia Department of Health and Dr. Danny Avula, the director of the Richmond-Henrico Health District, and recently appointed by Governor Northam, the COVID-19 Vaccine Distribution Coordinator for the Commonwealth of Virginia. Wow, that's a title. All righty. And Dr. Avula has brought along two distinguished guests this morning. Christine Gray, the Division of Immunization Director with Virginia Department of Health, and Dr. Chris Ghaemmaghami, Professor of Emergency and Internal Medicine and Senior Advisor to the Executive Vice President for Health Affairs at the University of Virginia, a key member of the Vaccine Virginia efforts. On behalf of all the membership and staff of the MSV, healthcare providers across Virginia, and our attendees this morning, I would like to thank all of you for joining us today and answering some questions about healthcare provider access to the COVID-19 vaccine. With introductions out of the way, Dr. Avula and our guests, the floor is yours for your sage advice.
Thanks, Dr. Veyer. Glad to be here with you all today. So it's been about 2 weeks since I've been tapped into the state role, and I wanted to kind of lay out for you all what I've learned, where we are, where we're headed. And maybe the first thing I'd say is that in the last 2 weeks, I have heard loud and clear many of the frustrations of my provider colleagues. I've heard challenges in terms of getting you and your staff vaccinated, despite being a 1A category and qualifying for vaccination from the beginning. And then I've also heard the frustration of many providers who have tried to get approved as CDC vaccinating sites themselves and have not had great feedback from either the federal government or from us. And so I will talk about where we are. I want to name those two things because I've absolutely heard that plight, and we've done a lot to help address it, and we'll talk through that a little bit. But so what I want to do now is kind of divide the challenge of vaccination into kind of three specific areas, and we'll kind of do a deep dive on each one. But as I'm trying to get my arms around this over the last 2 weeks, there's first the challenge of closing the gap, right? Our data shows that we have about 940,000 doses that have been distributed to Virginia. And as of yesterday, about 360,000 doses that have been administered. Yet there's a story in that gap that the public perceives, and many of you, I imagine, perceive that there's a bunch of vaccines sitting out on shelves, and why aren't we vaccinating people? And so really understanding where the vaccine is, how it's being counted, and how to tell an accurate story so that we restore confidence in you all and in the people of Virginia in this process. So really, like, closing the gap is definitely one area of significant work. The second area is addressing the current supply-demand challenge, because right now we are getting about 105,000 new doses per week in the state of Virginia. And when you start to parse that out by geography, when you look at how much goes to the Richmond area versus the Northern Virginia area versus Southwest, those dose numbers start to get really small. And for the first few weeks of vaccine distribution, that wasn't a challenge because there were only so many people who were scaled up and ready to go to vaccinate. But what we've seen in the last week or two is that has really shifted. And just as one data point, last week we had 295,000 requests for vaccine doses, but only 105,000 doses to distribute. So we'll talk more about that present challenge. And then the third bucket is what's the future challenge, right? If we really want to get the people of Virginia vaccinated by midsummer, we are going to need to get to a scale where we can do about 50,000 doses a day. You heard the governor lay that out as a goal about 2 weeks ago. And it wasn't an arbitrary goal. When we think about the adult population of Virginia, the goal to get to about 70 to 80% of that population immunized, the reality that the vaccine that we have now is a 2-dose vaccine, that really does mean we've got to get to about 50,000 doses a day to get through the population over the next few months. And so there is a distinct body of work to build the channels, to build the machine to vaccinate that many people at that volume. So let me talk about the first challenge, because I think that that gap of 600,000 or so doses, I think has led to a lot of frustration, certainly from the provider community, but also to the public at large. Again, say why are we talking about supply demand when we have a significant supply? There's a couple of places that the vaccine has. So a couple places that have really been a part of this challenge. So one, the federal government contracted directly with CVS and Walgreens to do all of the residents and staff of long-term care facilities. And so I don't think anyone would argue that long-term care facilities are nursing homes, assisted living facilities, group homes, independent living. I don't think anyone would argue that those are our highest priorities, right? As we've watched this pandemic over the last year, those are the places that have had the largest outbreaks, the greatest toll in morbidity and mortality. And so it's pretty clear that the residents certainly, and then the staff are typically the ones who introduce infection into those congregate care settings. And so, but what happened was that of our 943,000 doses, 226,000 of those were earmarked and set aside by the federal government for CVS and Walgreens. So they have all the vaccine that they need to make sure that they can vaccinate that incredibly high-risk population. And I think what we have seen over the last month is that getting through that has just created a lot more logistical challenges than anyone was prepared for. To date, if you go to our public dashboard, and if someone wants to make me a presenter, I'm happy to kind of share some of this if it's helpful. But if you go to our public dashboard, you'll see a breakdown of how the vaccine is distributed by category. And what you'll see there probably this morning is 34,000 of those doses are to long-term care facilities by CVS and Walgreens. Their actual numbers, there's always a little bit of a delay, a little bit of a lag. As we talked to state leadership for both of those organizations yesterday, that number is about 56,000 doses that they've delivered to date. But 56,000 out of 226,000 leaves a large delta. So 170,000 of those doses are, again, earmarked for Walgreens. So I think that there are a couple things we can do about that, and we are actively pursuing solutions in two directions. One, to make sure that we can help support Walgreens and CVS to whatever degree that we can to get to that population faster, because I think there's no doubt that getting our long-term care facility residents and staff vaccinated is of the utmost importance. And so we're pressing on CVS and Walgreens to staff up, to increase their schedule. CVS at this point has gotten through all of their nursing homes. Walgreens is scheduled to get through all their nursing homes by the third week of January. We and the governor actually called just yesterday, and so we are asking them to get through all of their nursing homes and assisted living facilities by the end of January. Alternatively, if they just cannot, based on their staffing, we will start to reallocate those doses to other pharmacies that have relationships with long-term care facilities, again, because of the public health imperative to get that population vaccinated as quickly as possible. So here is the dashboard that I mentioned. It's on the VDH website. If you start at VDH Home, you click on COVID-19 vaccine. This website explains what our different categories are, 1A, 1B, where much of the state is now. In fact, most of the state to date is actually in 1B, save a couple of districts. And then if you go to vaccine dashboards, this is where you can see this information. So, as I said, this gets updated daily, so probably around 10 a.m. when the data download is complete. And so as of yesterday, 943,000 and 360,000. And what you'll see here that is hopefully reassuring is that the doses per day have really significantly increased. The 7-day average over the last week, the average dose per day is almost 19,000 doses a day. You'll see in these last few days, because of the data lag that comes in from EMR to VIS transfer or manual entry where that needs to happen, that it takes a couple of days for that to catch up. But what you'll see is that clearly we're moving in the right direction. Clearly, there's more vaccine capacity and more Virginians are getting vaccinated. But back to closing this gap, this almost 600,000 dose gap. So there's a big chunk of it that's in long-term care facilities. The second place that much of this vaccine exists in is in hospitals. So while our hospitals and health systems have done a phenomenal job of vaccinating, they've done the bulk of the vaccinations in Virginia, they were given most of the vaccine at the beginning of this process. So when we recognize that in 1A, in addition to long-term care facilities, healthcare workers were also included. And so health systems submitted their employee rosters, and that request was met at 100% allocation. And what you probably all know is that not 100% of your staff or of the health system staff wanted to get vaccinated. That number was more like 50 to 60%. And so what that resulted in was a large amount of vaccine left over after they did their pretty rapid first rounds of vaccination. They're now going into second dose rounds, and I think some of the health systems were pretty unclear that they would get new deliveries of second doses. And so a lot of them have been holding back some of those first doses to make sure that they had enough for their population. We are working with VHHA to clear that up and to really impress upon them the importance of shifting that vaccine. That has happened in the last week. I think there are many, many examples of health systems that have both shifted outside their four walls to do more community-based vaccination, that have been embedded with their health departments to do large-scale vaccination. Valley Health in Winchester and their local health department are a great example. They've done 3 events to date where they've done between 1,000 and 1,500. This coming weekend in Danville, Sova Danville, and the health department will do about 1,000. And so there are multiple examples across the state where health systems and health departments have worked together to get to a larger swath of the population. But what that means is that right now there's about 250,000 doses that health systems are actively mobilizing. Some of those are slated this week for second doses. Some of those are being redistributed to other providers to do community clinics. But we need to work through that to close this gap. And then there's about 100,000 doses that have been administered, but have not been ported over to VIS yet. Many of the health systems, when they were using, did not use their EMRs to vaccinate. They used instead kind of their occupational health platforms that weren't directly connected to VIS. So there's a ton of troubleshooting that's going on right now and figuring out how we need to ensure those data linkages so that we can close that very rapidly. And so in various categories, whether it's registration system not talking to VIS, whether it's large scale community clinics that were paper vaccinated that need to be entered, that accounts for about 100,000, maybe 95,000 or so doses. So I hope that's helpful to understand that this 580,000 dose gap is actually pretty well accounted for in terms of what's in pharmacies, what's in health systems, and then what is actually administered, but just not updated yet. And I mean, it really is the top of my list to close that, to make sure we have the data talking to each other so that Virginia understands what's going on here. Because what has happened in the absence of that clarity is that people are really anxious and frantic because they feel like, I'm in 1B, I don't know how to get vaccinated. And I see that there's tons of vaccine out there, but I can't get it for myself. And so hopefully that was helpful in breaking down the first challenge we're facing, which is the closing the gap. All right, the second challenge is really this, the fact that we have 105,000 doses a week that have to get allocated around the state. And I just, maybe to make that a little bit more granular, I'll show you all here you go. So for this week, what we're doing is we are really just doing this by geography, right? So depending on the population distribution in a particular area, that you get a certain ratio of the total distribution. And so, and we've done this by health district. So let's take MSV is in the Richmond and Henrico Health District. So Henrico is 4% of the state's population. So they'll get approximately 4% of the allocation. And so this week, that is what, 3,800 doses. I hope that this is helpful for you to see that there's just not that much vaccine coming into any particular community. Like that 3,800, I mean, there are multiple outlets that can do that in one day. And so that is what we're presently facing, is that there are many, many people who can vaccinate at scale, who are asking for the vaccine, who are ready to get it out there to these priority populations, but very little supply. And the supply demand gap was really exacerbated by our move into 1B. So remember, we started in 1A. We were going to focus on healthcare workers and long-term care facilities. And I think we anticipated that we would be in 1A probably for the month of January. We really didn't think that we were going to go into 1B until February. But what happened is that in different parts of the state, people saturated their 1A demand very quickly. Southwest Virginia, as an example, has a much smaller concentration of healthcare workers. And so they were able to get through their 1A population within a couple of weeks. And what we did not want to do was hold back communities that had received vaccine, that had started their vaccination efforts. They were feeling constrained that they couldn't move on because the state hadn't given them permission to move on. For example, a large health system, again, got through its 1A population and then had to sit on those doses while they waited for the state to say, okay, we're in 1B now, we can move forward. So that's why you heard language from the governor a couple of weeks ago saying, hey, if you've got it, use it. We're going to be more flexible with these 1A, 1B categories, but the imperative is to get vaccine out as quickly as possible. Health systems and others who have the vaccine have kind of, internalized that in different ways or responded to that in different ways. But it hasn't led to an immediate shifting of practice with using the vaccine. So that's a big area of work. But the other issue around demand was that when we went to 1B, and as I said, much of the state is in 1B right now, the federal government really urged every state to open up 1B to include the 65 and up population and those with underlying conditions. Those were previously in Group 1C for us here in Virginia and in much of the federal guidance. But about a week and a half ago, the federal government was very clear. We need to add 65 and up. We need to add underlying conditions. And we will be releasing much greater amounts of vaccine. They were going to release all of their second dose reserves so that we could start to meet the demand. The next day, Virginia decided to follow suit and said, okay, we're going to add 65 and up and underlying conditions to 1B. And the following day, the federal government kind of turned around and said, actually, we're not doing that. Those reserves don't exist. And so we created this massive supply demand gap by adding 4.5 million Virginians to category 1B. If you take all of those individuals who are in 65 to 75 and then with underlying conditions. And so now we're kind of stuck with this massive mismatch of supply and demand. And so as we close the gap and help change the public narrative about what's happening with vaccine, I think there will be an opportunity for us to be more focused with the 105,000 new doses that we're getting a week. And so my hope is in the next week or so, we'll be able to course correct as a state and really help the public understand where they are in the priority list. However, in the present, it has just created a lot of hysteria because like I said, there's tons of people who are now in 1B who want to get vaccinated who don't know how to do that. What has been happening in most districts across the state is a combo parallel approach where there have been clinics for the 65 and up and underlying condition population. Their health systems are handling much of that. Some pharmacies and providers have started to receive small amounts of vaccine, and they're doing that segment of the population. And then the health department is focusing on what we call closed pods. So the 1B list is actually tiered, and I will show you that again. So the 1B list has a number of different categories that include fire, hazmat. Let's see here, how do I find it? All right. So back to that page that we were at. All right, so here, the 1A, 1B, 1C definitions. If you click on 1B, you will see all of the different categories that are in this 1B, including 65 and older and those with underlying conditions. Now, the guidance we have been given, although I understand that has not been as clear to some districts as others, is that our goal was to do frontline essential workers by order of vaccination planning. And so we wanted to systematically work through each of these tiers. So the health departments would do closed pods with their police and fire and hazmat. They do closed pods with corrections. They do closed pods with teachers and childcare workers. But for various reasons, that has happened slightly out of order. And again, that has added to the frustration and confusion of many of our residents. So moving forward, we're going to really we're going to try to get this message out that there will be, that 1B is a huge group, and that just because you're in 1B doesn't mean that you can get vaccinated immediately. It does mean you should be at the front of the line if you're 65 and older or have an underlying condition. But if you are in one of these essential worker groups, we're going to work systematically through those groups, and that will likely take, with the rate of vaccine that's coming in, that's likely going to take a couple of months. So that's the second body of work in building this, in meeting the supply-demand challenge. The third body of work is really future facing when vaccine supply increases significantly. As I said, we've got to have the machinery to get 50,000 doses a day out. Now that's going to happen through multiple channels. It's going to happen through health systems. It's going to happen through health departments. It's going to happen through pharmacies, and it's going to happen through you all. It's going to happen through providers. And so we are in the process of continuing to onboard providers. There's about 3,800 providers that have expressed their intent to be a vaccination site. To date, probably somewhere around 1,200 to 1,300 of those providers have made it through the CDC gauntlet and been approved as provider sites. And then in the pharmacy side, there's a little over 200 pharmacies that have been approved as well. And I think that has also led to some frustration because I think we could have done a better job of communicating and providing a feedback loop. We did not realize that the CDC site did not do that. And so I think there were a lot of people who applied 5-6 weeks ago and never heard anything and said, what is the deal? What's going on? So what has happened more recently this past week was that VDH updated its provider site. And so if you, if you're on that website, you'll see resources for healthcare professionals. And there's a bunch of things here, including trainings on how to use the Pfizer and Moderna vaccine, trainings on the reporting systems, information about how to actually get approved and enroll as a CDC site. And so I'll have Melina can send that link out if she hasn't already, but there's a lot of information on the website for providers to better understand how to get enrolled if you're interested, and what you need to know to vaccinate effectively. But I think moving forward, I don't think that we're going to have the vaccine supply to do that 50,000 dose a day scale likely till March, maybe beyond. I think the things that will change that are probably the introduction of AstraZeneca and Johnson & Johnson that are still working through their clinical trials, and are yet to finish those, and then they'll have to go for FDA authorization. So we'll see. I heard Dr. Fauci say a few days ago that we're weeks away, not months away. But not exactly sure what that means at this point. But all that to say that when it does happen, when supply does increase, we need all of the channels to get vaccine out as quickly as possible. And you all are clearly a huge part of that. All right, so let me pause there. That was a lot, and happy to field questions. I've got two phone a friends here with me that can help answer some of the more technical questions. But yeah, where do you all want to start?
Well, Dr. Avula, if you pull up the Q&A function, there are 4 questions that have popped up, and you can roll through those initially.
Great. The first question from C. Davis, are we moving efforts away from traditional business hours? Definitely we are. So many of the mass vaccination efforts that are happening currently around the state are happening on weekends. In addition, as we think about large scale vaccination, in addition to the 4 channels that I mentioned, health systems, health departments, pharmacies, and providers, we are also planning to add a 5th channel, which is fixed site large scale vaccination. So VDEM and the National Guard and VDH are all right now identifying about 12 sites across the Commonwealth that would serve this need well. The National Guard is currently deployed in Washington, D.C. through the inauguration, but they should be freed up later this week and will start filtering back into Virginia next week. And when the time comes, when the supply can actually substantiate 10 to 12 fixed sites, they will be 7-day-a-week operations, and they will be staffed by the National Guard with additional vaccinator support. But really, like, we don't need to press go on that until there is enough vaccine to feed that. All right, let's see. Mitchell Miller. Communication has been extremely poor. Noted. We definitely recognize that. I think it has been a huge focus of my time and energy to both make sure that we're getting this understanding to groups like you all, to elected officials, but also we've got to do a better job to the public at large. So we've got to own that. We hope that the reality is that the public health infrastructure, which has been historically underfunded everywhere, and in Virginia as well, has been stretched incredibly thin over the last 10 months. When you think about the challenges of contact tracing and case investigation and testing and all of the things that have just stretched this membrane, but you're absolutely right. We've got to get better at the communication. So I appreciate you noting that. Anything else on that? How can we get info on and when we will receive doses? So to that question, we are building out a provider support team. In fact, Christy Gray and Chris Ghaemmaghami are both key parts of that provider support team. We've just onboarded new staff this past week. And so I would start with the website, and there's a link to an email address. And Christy, any other thoughts on how soon that provider support team will be ready to go, or how we can direct physicians who have questions?
Sure, Dr. Avula. We do also have an email address that is specifically meant for provider interaction and questions that you can start with, and that we are responding to that, reviewing that email address every day and following up on those. Can we put it in the chat?
Yeah, that'd be great. Thank you.
And I'll just let you know that the link that you're talking about that we have so far is on our website, and we'll also send in an email all the important links with this webinar and that email address to all participants in this call, as well as all of our members after this.
Great. Thanks, Melina. Okay, is there any intent from the governor or from VDH to expand providers who can give the shot? For example, I think some states are letting veterinarians do it. Yes. So right now, Executive Order 57 is being revised. And what that will do is add dentists, dental hygienists, veterinarians. There is a separate executive order, or maybe it's the same one, but there's another executive order coming that will add protections for student classes as well. And then I think it's also important for you all to recognize that Executive Order 60 actually covers any liability concerns in the state of emergency for all approved vaccinator types. So all of you and your vaccinating staff, if you were to be pulled into or offer up to be a mass vaccination site, your liability coverage would be addressed by both Executive Order 60 on the state level and then something called the PrEP Act at the federal level. For VDH sponsored events, we would still like providers to go through the Medical Reserve Corps. It's our best way to keep people organized, to help them, anticipate if media shows up to events. And there used to be more orientation, and what we've done is we've streamlined that down and stripped it down so that you do a 45-minute orientation, you do a background check that typically takes 2 days to get back, and then you just do an on-site skills assessment. And so that's all it takes to get through the MRC and be involved in mass vaccination events now. Are the second doses still being held in reserve, or are all doses being given without plan for supply of a second dose? So, what has happened over the last 2 weeks and what I anticipate happening moving forward, the Secretary Kerry just spoke with General Perna a couple of days ago and confirmed this, that second doses are being separately shipped by the federal government to each entity that has received first doses. So let's say you are a large family practice group in Harrisonburg and you got 1,000 doses this week of Moderna. 4 weeks from now, you will automatically get 1,000 second doses of Moderna. So that is above and beyond our 110,000 dose a week allocation. So last week we had 106,000 first doses that we were able to allocate. But in addition to that, there were another 61,000 second doses that were shipped directly to those sites. So it is a second bucket. And this has created, like I said, some confusion for health systems that have not been confident about that or not clear about that, and so they've been holding some of those doses for their folks. Okay, let's see. What about healthcare workers and practices that are not hospital related or applying to be vaccine providers, such as mental health practices? Many of those providers are included in 1A if they are, patient facing and have the risk of patient to patient contact. There's a lot more information about that on the website that I showed you that shows you 1A, 1B, 1C. There's a link that does a deeper dive on 1A. And then there is the support document for that really clearly defines all of those. And Christy, if you could pop that link in the chat too, that would be great. But yeah, so there are, and in fact, some human services providers as well, like home health workers, people who work as social workers and are doing home visits, things like that are included in 1A. What are the channels available to the public or press regarding your plans, progress, and efforts? I'm getting a lot of questions. Well, open to suggestions here. So we do one press event a week with the governor's press conference. I've started this week, we'll be doing 2 press briefings with media outlets. We did one last Saturday that had over 100 attendees, but that feeds the press, so that will start to shift the public narrative. I'm doing a lot of engagement through elected official town halls. I presented to the House Democratic Caucus last night. 2 nights ago, we'll do the House Republican Caucus tonight, and then that has led to more town halls. So those are the channels that I'm using. The communications team is building out other channels. We are going to start a bi-weekly written communication that kind of maps out some of these things that I've talked about with you here today. My hope is that that's ready to go by the weekend, and we can get that to MSVs for distribution to all of you as well. We'll do that as well to elected officials because, I think you, like they, have heard from hundreds of people a day saying, how do I get vaccinated? And so we've got to do better. We've got to make the information clear and give you all answers that you can convey to your staff so that they don't lose confidence in you and really in us. So as a follow-up, it's not helped that the local media made a big splash of large systems starting in 1B. So patients are seeing this, they're feeling like second-class citizens. I have frail 75 and overs that should be up there, and they're seeing media reports. Yeah, I totally hear that, Mitchell. I think that, just the allocation decisions at the beginning of this to send everything to health systems, because that's where the bulk of our 1A population was, has not gone as ideally as we hoped. I mean, both in terms of the uptake numbers, but also, some of the unanticipated challenges in health systems being able to shift outwards. And I don't want to cast them all in a negative light, because some health systems have actually done a great job and been incredible partners to serve the community outside of their four walls. But there's been some variability across the state. I have 2 staff that received first dose and scheduled second dose on VAMS. They'll be in different regions when the second dose is due. We've received mixed messages about whether they can schedule second dose in a different region, but VAMS allowed it. So this is one of the challenges with VAMS, which is that you can schedule clinics anywhere in the state. And it's why, so that's one of the challenges. There are multiple other issues with the VAMS system. And so for that reason, we are actually phasing VAMS out and phasing a different system called PrepMod in. But to answer your question, we've tried to address where it's happening in large scale. So for example, there's a segment in the southwest part of the state where one district was really intentional about scheduling second dose visits, and another district was not quite as intentional. And so a lot of those individuals were trying to get their second dose in the neighboring district. Those health districts are working it out and trying to make sure that people have the opportunity to get their second dose in the district that they received it, and know that we are absolutely prioritizing second doses. We know that everybody who's gotten a first dose who wants to get a second dose, and we hope that's everybody who gets vaccinated, we really need to prioritize that. Again, acknowledge that the rollout of that has not been incredibly smooth. I think we really need to be making second dose appointments at the time of first dose vaccination, right? It's what you all do in your practices. It's what we need to be doing in the mass vaccination context. I think the uncertainty, now that we have a little more information about how the federal government is doling this out, and more confidence that it's actually coming, we'll see a lot more of that moving forward. I'd like another update about 2 weeks from now on the status of vaccines already delivered, specifically including fact-based printed accounting for the amount remaining on hold and the amount to be released for the next year administration. So in that written communication I mentioned, is there an organized, sorry, I'll answer that one first. So in the information I mentioned, so that bi-weekly thing, that's the kind of things we'll include, Brian. And so we'll push that out through MSV so that you have access to that. Is there an organized process for transportation and record keeping to move those doses laterally? So there has been some redistribution that's happened in the early goings of this, and that has been hard, because what happens when one provider redistributes to another is, if the accounting around the CDC issued number, it's called the VTRAX number, isn't really tight, you start to lose track of it. Now, it hasn't happened on a scale that we're losing track of a ton of doses, right? Like all the main providers that are receiving vaccine know where they've distributed vaccine to, but it is requiring, because VAMS has not supported this very well, it is requiring a manual chasing down of that information. So that's one of the things we're trying to do away with. And what we really want to happen is less redistribution and more direct allocation and delivery to approved providers. So you've named another bump in the coordination of this that we're solving. Okay, what tools do health systems and long-term care facilities have to improve staff uptake? So what, in my conversations with the state leaders of CVS and Walgreens, we have basically pushed 3 mechanisms. 1, just do it. Like, get more staff, hire more staff, reallocate your staff from your stores and do it. And so they are coming back to us with a plan today of how they're going to staff up to get through all of the long-term care facilities in the next 24 hours. If we're tracking that and it's not and they're not able to meet those targets, then we go to options 2 and 3. Option 2 is augment their staff with other providers, whether it is medical reserve corps volunteers or local government EMS that can vaccinate and would be willing to fold into the operation of a CVS or Walgreens. Augment your staff so that you can get through those long-term care facilities faster. So that would be option 2. CVS and Walgreens are talking about that at the institutional level. Is this something that we can do? How do we incorporate these? Ultimately, it'll be their decision about if they're willing to do that or not. And then option 3 is if those things cannot be done, then reallocate the vaccine to other pharmacies and providers who can vaccinate those institutions. And so Stephanie Wewell, who's the state pharmacist and our lead on onboarding new pharmacies, is, and because so many of these long-term care facilities already have established relationships with pharmacies, it does make sense that that would be the channel that we would use. So I anticipate there will be some reallocation to those pharmacies to get through that population more quickly. Okay, I'm a mental health provider in Virginia Beach and found that I'm 1A eligible to receive the vaccine. Where do I go to get it? So if you're in Virginia Beach, I would start with your health department, because the health department is actively doing clinics every day, and they're doing large scale clinics. I mean, they're getting through 1,000 people a day at the Virginia Beach Convention Center, and as vaccine becomes available. So I would contact your local health director. Dr. Demetria Lindsay is the health director in Virginia Beach. If that fails, I mean, again, everybody's really overwhelmed. And I have not checked the Virginia Beach Health Department website, but what we are asking every health department to do is on their local website, have a clear pathway for 1A and 1B individuals to register, and then a feedback loop for those individuals. And so, if you go to the Richmond and Henrico websites, as an example, you will see those fields, and we're trying to ensure that there's some consistency across local health districts. I think it'll take a few more days to get there. But that's where I would start, with your local health department. And if that doesn't work, there are also provider clinics that are being run by Centera, and Riverside did a bunch as well. I guess that's not super close to Virginia Beach. That's more the Chesapeake Southside area. But those are the 2 primary channels where vaccine is coming. And feel free to reach out to me if that's a challenge, and I'll have somebody on the team push through for that linkage, because as 1A population, we need vaccinated. Okay, if private practices choose to vaccinate non-patients, will there be a temporary approval for reimbursement of those insurances, which the practice doesn't accept? I don't actually know the answer to this. Christy, I don't know if you do. There's somebody on our team that is one of our additional staff that is the expert on provider reimbursement, but I just haven't gotten there yet. You know, Christy?
Yeah, the reimbursement piece is, when we've had discussions with DMAS and the other MCOs, it was determined that the insurance plans are actually much ahead of this on uncovering this vaccine. Regarding whether you yourself have the contract with that insurance plan to cover it, it's a little bit, I think, a little bit more complicated step that we can look into. But we know that it is covered. And if you are having any issues with any uninsured persons, there is a fund that's set up with HHS that you can charge the admin fee to get reimbursed, because this is not supposed to be there's no barrier, there's no out-of-pocket cost to the patient. So that's something that we can take back and follow up with the group.
All righty, Dr. Avula, one question. Would there be any utility in having physicians reach out to pharmacies, et cetera, to partner on clinics or distribution efforts in their community?
I I think that particularly with the long-term care facility, there may be a need for that, and so I will know better by Friday. Stephanie Weewill is kind of doing the work to match up, what pharmacies have what capacity. If we were to reallocate vaccine, how would we do that? And then if there's a need for additional vaccination support, that would be one way to do it. The other thing that would may be an opportunity for folks to plug in is in some parts of the state, there is limited vaccinator capacity. I think largely in the Crater Health District and some of those more rural areas of Dinwiddie and Surrey, we're trying to identify more vaccinator support. Again, vaccine shortage the vaccine supply will drive just how many events there are. But there are a few parts of the state that I think could take more physician vaccinators. Probably the most direct pathway right now is go ahead and sign up for the Medical Reserve Corps in your community so that at the time when that vaccination support is needed, you can be ready to go and deployed. But I will check in with Stephanie and let Melina know as a follow-up if there's a need for an all-call to the MSV membership to join the pharmacy effort, particularly with the long-term care facility group.
Okay, thank you. And then I know you've answered this, but I'm getting feedback that it still seems overly complex. So one more time, how can my staff get the COVID vaccine? I'm kind of one place where we can go, not kind of looking around.
Yeah, I think your local health department website is the place that you should go. And so go to your local health department website. You can, I will show you how to get there. All right, so at the VDH website, you'll see a tab here that says health departments. And then based on where you live, go ahead and click on that, and that will take you to the website. So I'm in Richmond. We're here at the Richmond Health Department website. And then how do I get vaccine? Whoops. It's coming. All right, so then here is where you would fill out your one. We actually used to have a link that said 1A interest form. Here it is, phase 1A interest form. So then you fill out this phase 1A interest form, and then someone will schedule you into a clinic to get back. So this is the kind of process that we're trying to standardize across the state. Many health departments have this, a few don't. My hope is that is rectified by early next week.
All right, excellent.
And I'll just say again, if you are having trouble getting contact or access to your local health department, go ahead and email me and I'll get it to the right person.
Okay, and then if there are local hospital networks that are doing vaccination clinics, what would be the best route for a provider to contact that network? Say, for sake of argument, I'm in Northern Virginia. I'm a Centera employee. I've already gotten mine, but in terms of getting a patient into a COVID vaccine clinic there.
Yeah, I wish I had a better answer for you. I think it's so variable based on how the health systems or whatever provider is handling those mass vaccination events. And so I recognize that the lack of standardization has created a lot of confusion. And so that we've just got to continue working towards clear pathways on the local health department website saying, here are the clinics that are available in your community. As PrepMod gets integrated over the course of the next week or so, the hospital systems have already used uploaded PrepMod as their registration system. Local health departments will as well. And so the goal is that when everybody's using PrepMod, there will be a centralized place on the local health department website where you can actually go through the registration process for a clinic. That's not happening yet. And remember, I don't think anybody anticipated being in 1B on January 21st. I think we were looking at a longer timeline for that, and thought, but the sort of race to get to 1B, I think left us unprepared in some regards.
All right, excellent. And let's see, Melina sent me a message that MSV did send 8,000 emails to community providers to help with the outreach process. So if anyone needs to provide your email information to the MSV, they can reach out to Jenny or Melina via email. So that's another resource. So, and then there's a couple more questions that popped up in the Q&A.
What is the anticipated turnaround time after completing 1A form? It really just depends on how much vaccine comes into the community and how many vaccine events they're doing. So it could be this week. It could be 2 weeks out. I would be surprised if it was any longer than that. You know, there will still need to be some patience as these vaccine events are getting planned. Where do I sign up to become a provider and get vaccine for my patients? So on the Virginia Department of Health website, Christy will pop that in the chat again, or maybe she already did, but there's a link for providers to get information and learn how to enroll as a vaccinating site.
All right, excellent. Well, we're coming up on 7:53. We've gotten all the questions answered because we have a MSV board meeting at 8 o'clock. So, and that I have to preside over too. So I thank profusely our panelists and all that attended this wonderful webinar. Great information for us. Thank you so much for being so generous with your time. It is most appreciated. And thank you so much for all the great work you're doing for the Commonwealth. We really appreciate it.
Thank you, Dr. Baer and Melina. And again, I just want to say this is the kind of thing we should have been doing a few weeks ago, and I think we just need early and often is how it needs to work. And so my commitment to you all is to make sure that we're getting out something about bi-weekly that just gives you updates on where we're at, where the vaccine is, what's going on with providers, and so we'll push that through MSV so that folks can be more in the know.
All right.
All right. Take care.
Thank you so much and have a wonderful day.